Hello and welcome to your program of choice, Health Affair on AITA, a program where we discuss everything about health challenges with a view to finding lasting solutions. I am your host, Mowa Daniels. Diabetes used to be regarded as a disease of the elderly, but do you know that now even babies are not spared? Many babies are born with diabetes and some die from the disease due to ignorance and misdiagnosis. Everyone is at risk of diabetes. These and many more will bring to you today on the program after our news segment.
The Lagos state government has warned incoming passengers from abroad who shun the federal government guidelines against COVID-19 to stop it or face the consequences. This is to protect Lagos residents against the fatal effects of the pandemic and to avert a second wave in the state and Nigeria at large. The federal government has said those who fail to respect the protocols will have their passports impounded or visas cancelled. The COVID-19 pandemic is not abating as many European and American countries are experiencing second and third waves with devastating impacts on lives and livelihoods. Some figures made available by experts at the Institute of Family Development show that 1 in 4 girls is sexually molested before the age of 18, while 1 in 6 boys is also molested. Child sexual molestation has indeed become a green menace across the world. It is the need to find a lasting solution to this problem and equip the children against predators that has necessitated the call by experts for intense public health education.
Every sector should be involved. The education sector, the government should ensure that children are equipped.
So the Ministry of Education, Ministry of Youth and Ministry of Justice, we are ready to bring perpetrators to book on this crime.
You basically need to look for materials and get materials. You don't know it, so get materials. There are now books in the market that you can buy, like Dr. Nimi's book and several other materials available. Once you are equipped as a parent and you are empowered, then it becomes very easy to empower your child.
The speakers also called on parents to break the culture of silence by reporting rape cases and be close to their children.
Busy, we're running around, we have to make money, but our children are so important to us. And in the sad event that your child has been abused, don't throw them away. They are important. Don't shame them, love them, and go all out. Make sure that the child is medically treated.
Though the prevalence rate of HIV amongst adults is less than 1.3%, Nigeria has the second largest HIV epidemics in the world and one of the highest rates of new infection in sub-Saharan Africa. Despite the progress made in scaling up on HIV prevention services, the low access to antiretroviral treatment remains a challenge.
Majority of Nigerians that have been affected with HIV do not have access to these drugs that are supposed to make them alive.
To achieve the 2020 World AIDS Day theme of global solidarity, shared responsibility, experts harped on the need to end stigmatization. Diabetes, also called diabetes mellitus, is a group of diseases that results in excess sugar in the blood, that is, high blood glucose. Recent statistics by the International Diabetes Federation indicate that about 425 million persons are living with diabetes mellitus worldwide, with nearly 50% undiagnosed. The statistics also show that developing countries like Nigeria contributes a larger percentage to these figures. With me on the program to discuss this topic today is Professor Abiola Uduole of the College of Medicine. Professor Uduole is also a consultant pediatric endocrinologist at the Lagos University Teaching Hospital, LUTH.
Diabetes is here. It's not going to disappear. And there are a lot of things that we can do to prevent us developing diabetes. We need to be aware of our history in the family. So if you have history of diabetes, make sure that your lifestyle will be um, good enough for you not to develop diabetes. And you hear many people say, I have, my diabetes is gone. Diabetes doesn't go. You just think it's because you're not checking your blood sugar. If you're checking your blood sugar, you're not doing anything about it. Your diabetes is there. So by the time they now realize they have diabetes, it's probably when they have the complication. Maybe a leg ulcer, maybe a stroke, or maybe their kidneys have failed. Then diabetes management becomes extremely expensive because you now not only have to take care of your diabetes, you have to take care of the complications. So if you have diabetes, many people are told they have, oh, your blood sugar is high. They say, it's not high, it's the food I ate yesterday. And they would refuse to go and do another blood glucose until something happens to them.
Before now, people think that only adults are at risk of diabetes. I understand children can have diabetes too. Can you tell us more about this?
The ones that usually takes the life of the children is what we call diabetes ketoacidosis, and that one is usually associated with an infection, maybe a malaria or something, but it will just get out of the way. And unfortunately, most places don't know how to manage it. In fact, because people don't think that children have diabetes, they don't even check their blood sugar. And some of them, when they come in because they are very bad, some people have given those kind of children what do we call it now? A solution, IV solution that has glucose. So it's like killing them very fast. Because somebody has a high blood sugar, you go and give glucose again. Before they know where they are, the child is gone. But you cannot fault the doctors. They have not checked the blood sugar. Most hospitals don't have the facility to check blood sugar. That is the truth.
How can we prevent diabetes? And for those who already have diabetes, how can they manage it?
I always tell people, don't let diabetes rule your life. And they look at me and say, why would diabetes rule my life? You rule diabetes. Wow. And the way to rule diabetes is make sure you are taking your drugs, make sure you are active, make sure you are eating properly, adequate, balanced, in the right quantity meal, and make sure you check your blood sugar. Some people don't check their blood sugar at all until the day they go to the hospital. How do you know that you are improving if you don't check your blood sugar? Even if you are a type 1 diabetes, it has been known now globally that every diabetic should check at least their blood sugar once a day, minimum to twice a day, because that is the only way you know whether you are balancing your drugs, your activity, your lifestyle appropriately. And if you're a teacher or you are a mother and you suddenly notice your child has lost some weight, is urinating so much, is bedwetting at night, he was dry before, and is eating voraciously and is still not gaining weight, and is drinking a lot of water more than he used to do before, please take that child to the hospital, let them check the blood sugar. It just may be diabetes that the child has.
I hear people say don't eat this, don't eat that, eat plenty of beans. What should a diabetic not eat?
There's no food they cannot eat except refined sugar. Any food with refined sugar you can take. Fizzy drinks, that has carbonated drinks, that has sugar, yes, you cannot take it. Like donuts that has all the sugar on it, you can't take. There are plain donuts, but anything fried is not really very good for you. You prefer you to eat something that is not fried.
What about meat?
Meat on its own will not give you diabetes. But when you eat too much meat, that means at the end of the day, you're always going to have extra glucose on board that you don't need, extra fat that you don't need, And when you start accumulating all those extra, that is when problem starts. Not that there's any food that you cannot eat, but quantity and quality is also very, very important. And I would advocate that for every adult, at least once a year, please do your blood sugar. Go to the lab, let them do your blood sugar for you, just to be sure that you are not diabetes. If you're a mother that has had GDM before, please, if you have never checked your blood sugar, please try and check it just to be sure.
What is the difference between type 1, type 2, and gestational diabetes?
This gestational diabetes it only occurs during pregnancy. In those days, they used to say once you have the baby, the gestational diabetes will disappear, but you have another one. But unfortunately, with more research that has gone into this gestational diabetes, is we found now that if you have gestational diabetes, the chances that you become diabetic later is high. So if you've had GDM, we call it GDM, before, you actually need to be seen by your doctor. Monitoring you doesn't know that you see the doctor every month or something, maybe twice a year. And during that twice a year, your tests are done to make sure that you are okay. And the reason why you need to see your doctor is that as soon as you find being seen that you are being converted in a way to diabetes, it will be tackled quickly. If you had put on a lot of weight, you'll be advised to lose your weight. If you already have started having glucose in the urine and you are not active, they will advise you, be more active. You see the dietitian who will actually, not that they're telling you not to eat, they teach you the appropriate quantity of the various food that you are eating. That's so you will probably not become a diabetic patient. But it's been well known now that if you have GDM, the possibility that you have to become diabetes in future is high. It has also been found that babies of this GDM, they also have a higher propensity to develop diabetes later on in their life. So usually for babies of GDM, now it's been advocated that when you have a baby, that baby should be followed up, on an annual basis to make sure till they pass puberty. Because puberty is also a time when if you have the risk or the possibility of developing diabetes, that it can start. And the reason is the hormones that changes when you go into puberty can trigger off a diabetes. So until that child passes diabetes, in actual fact, a child of a mother with GTM should be followed up until they have passed through their puberty.
What's the take-home message to parents, to individuals, to government, and everyone that is concerned?
Just make sure you stay within a good weight. Don't be too, especially if you have history of diabetes in your family, try not to increase your weight. If you have a child too, and you already have a history of diabetes in your family, activity. Children are very active, but nowadays, a lot of our kids stay in front of the television, doing the PlayStation, or they're on the computer, or they're texting, rather than playing. In those days, you come back from school, you help a little bit in the house. If you're a boy, you have tires, you are rolling your tire, or you are doing 5-a-side football, or you are doing, you are active. If you're a girl, you are doing 10-10, or you are doing sway, or skipping rope. Understand those skipping 3 people, you go in, you come out. But nowadays, children are not doing that. They are more of sitting down in front of the television. And those things are increasing the risk. Before, we didn't used to see a lot of type 2 in children. But believe you me, we're beginning to see them. And that is because our children are becoming more obese than before.
What is the difference between high blood sugar and low blood sugar?
The word hypo means something low. The word hyper means something high. So hypo means low blood sugar. Now, low blood sugar can occur physiologically. Maybe you have not eaten. You've not eaten well the night before. You didn't take breakfast, and then you become very, very active. Your blood sugar can drop, and you can become hypoglycemia. Now also, like I always tell most patients, we are not God. It's only God that can balance things efficiently without any fallout. Sometimes some patients, like my patients, the children, they didn't take their insulin, especially those ones in the universities. They didn't take their insulin in the morning. They didn't take it in the night. Then when they get to night time, they're going to take double dose because they know their sugar is high. Then, of course, it's too much. So the blood sugar will crash and invariably they become hypoglycemia. We're always afraid of hypo because if hypoglycemia is bad, it can affect your brain. Once you are below 70 for a diabetic, you say you have hypoglycemia. But if you're a normal person, usually it's 40. That when a child is becoming hypoglycemia, he may may start sweating profusely. You just see the child is sweating so much, all right? And then if you look at the face is looking as if it's drawn, like it suddenly looks very tired, and he may actually tell you, I'm feeling sleepy, and he may put his head on the table and sleep. But that is a very dangerous sleep because he may not wake up from that sleep if the sugar continues to drop. So when you know that a patient is something like on insulin, or you know that a man is on a drug, like for me, that can predispose the person to hypoglycemia, and you started seeing the person is sweating, all right? Everybody is cool in a AC room and is sweating profusely and is behaving. Sometimes they misbehave. They start behaving in an abnormal way. When you see all these things and you know the patient is diabetic, the best thing would have been to check the blood sugar. All right. But in a place where the facility to check the blood sugar is not there, please give any sugary thing you find, whether it is a cube of sugar or granulated sugar or honey or carbonated sweet drink or fruit juice. You can just give the child. For the risk factors, type 2 is the most easy to prevent. Just make sure you stay within a good weight. Try to live an active life.
So for those who don't have the means to do all this and to buy drugs, doesn't mean that it's a death sentence for them.
It's not a death sentence for them. That is part of what the society, the different society that has to do with diabetes are actually advocating with the government with. That diabetes management should be put on the essential drug list. That it should be part of the health insurance scheme. Because if it's part of the health insurance scheme, then the patient will pay minimally because it's insurance, but will be able to get their drugs regularly. And at least they'll be able to get a glucometer and be able to get strips. And if not anything, they can do their blood sugar once a day. So there's a lot that the government can do to help. Because why most patients are bad is that there's too much out of pocket buy. And whereas if we can just admit people with diabetes, especially the children, it's very difficult for parents. Here they are, you have 4 children, and one of your child is diabetic, and the child is on injectable insulin because that is a drug for type 1 diabetes. And this patient is spending almost 20 something thousand every month on the child to buy the drugs, to buy the glucometer, to get the reagent strips, and to make sure this child feeds well. I spend about 20,000 on the child. Child with diabetes needs the support of everybody in the family. Everybody. If you have siblings, if you had cousins, aunties, one, not only just to buy the drugs, but also to give the psychological support because it's not easy for the parents. And one thing that we have always advocated for is what we call diabetes education. The reason why most people don't have support is because most people don't know what is diabetes. Most people don't understand the physiology behind it. Are you getting me? And what the patient needs. Some people are even afraid of diabetes. They think if they come close to somebody with diabetes, they will get it. Diabetes there's nothing, you cannot get it. It's not transmissible. Yes, you can inherit it, but you cannot transmit it to somebody else. So, but some people, immediately they say they are diabetic, they are ostracized. Nobody wants to talk to them. Nobody wants to play with them. If it's a child, they keep telling all the other children, don't play with that child, though. He's very sick, But diabetes does not say you are sick. Diabetes does not say you cannot do things. We have presidents, we have marathon racers, we have footballers, we have athletes, we have senators, we have engineers, anything you can imagine. Even now, unlike before, they didn't used to allow pilots who have diabetes to fly, but now they fly. So we have pilots who are diabetes. So sky is the limit for anyone that is diabetic. Please, no person with diabetes should use diabetes as a reason why he or she is not progressing. It is not easy, I know. For type 2, many times if you are diagnosed on time, you can actually get away with just managing your diet. Make sure that you are active so that the little glucose that you have on board that you are not making proper use of, you can burn it off with the exercise.
Thank you very much for coming on the show, Professor Dole. We appreciate you. We'll be right back after this break.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
Welcome back. It is now time for our nutrition segment, where we preach the message of eating right to stay healthy. Our focus today is on egg. Egg is an oval body with one end larger than the other, and it contains an embryo. Eggs are laid by female animals of many different species, including birds, reptiles, amphibians, a few mammals, and fish, and many of these have been eaten by humans for thousands of years. Bird and reptile eggs consist of a protective eggshell, egg white called albumen, and egg yolk. The most commonly consumed eggs are the chicken eggs. Chickens are kept widely throughout the world, and mass production of chicken eggs is a global industry. In 2009, an estimated 62.1 million metric tons of eggs were produced worldwide from a total laying flocks of 6.4 billion hens. Bird eggs have been valuable foodstuffs since prehistoric times. In hunting societies and in more recent culture where birds were domesticated, the chicken probably was domesticated for its eggs from a jungle fowl native to tropical and subtropical Southeast Asia and India and some continents before 7500 BC. Chickens were brought to ancient Egypt in 1500 BC and arrived in Greece in 800 BC, where quail had been the primary source of eggs. In ancient Rome, egg meals often started with an egg course. The Romans crushed the shells in their plates to prevent evil spirits from hiding there. In the Middle Ages, eggs were forbidden during Lent because of their richness. Egg yolks and whole eggs store significant amount of protein and kaolin, and because of this, they are a common food as can be served as main dish, an accompaniment to other dishes, and one of the most versatile ingredients used in cooking. Due to such versatility, an egg is considered a primary ingredient in culinary preparation. providing moisture and richness in dishes. It is widely used in catering industry worldwide. In 2019, the world's largest producer of chicken eggs was the United States of America, producing 9.41 billion eggs, with 8.2 billion for table consumption and 1.2 billion for raising chicks. Eggs, when eaten moderately, are a major source of protein. They also contain several vitamins and minerals that are an essential part of a healthy diet. They are also readily available and inexpensive. A 100-gram serving of egg, either raw or hard-boiled, supplies between 143 to 155 calories of energy. Protein, 26% of daily value. Fats, 15 to 60% of daily value. Cholesterol, 124% of daily value. Vitamin A, 10% of daily value. Vitamin D, 20% of daily value. Vitamin B6, 10% of daily value. Iron, 9% of daily value. Now, let's take you to our clinic.
What people do, generally, they have red eye. They assume it's Apollo. General thing is to use chloramphenicol. They go to the chemist and buy. The people who will even buy chloramphenicol are the enlightened ones. I've had people do very dangerous things. People use onion, put onion in the eyes. People put urine in the eyes to treat Apollo, so to say. And then sometimes when this patient presents to us, so we're not just treating the red eye, we start treating the complications of the treatment that they have done. You see, when you tell me your eyes are red, it could be so many things. It could be from as simple as allergic conjunctivitis to as serious as uveitis. And the treatment for all of these things are so different. And that is the reason why, as patients, we shouldn't self-medicate.
You can contribute to our perception segment by reaching us on the phone numbers showing on your screen. It is a segment where we track people's opinion about the health sector and other general issues that affect human lives.
It is not over. COVID-19 is still real. COVID-19 is still in Nigeria. COVID-19 has not disappeared like some people are saying. And that means they should please continue to adhere to those precautionary measures.
This is where we end the show today. Till we meet again next week, Wednesday at 9:30. Thank you for spending your time with us. I am Ushuomowa Daniels.